In this video, we'll discuss about actinomycosis. So, it is an infection which is caused by Actinomyces israeli, which is a anaerobic gram-positive filamentous bacteria. Now, usually, what is asked is, usually a lot of students think this that actinomycosis is caused due to a fungus, because the other name of actinomycosis israeli is ray fungus. But it is not caused by a fungus, it is actually caused by a bacteria. It is called as a fungus because it has mycelia around it, which are in the form of a filamentous form. So that is why it is called as ray fungus. Okay, so this is a major question which usually goes wrong. And secondly, it is normally present in the oral cavity, the tonsillar crypts, also the dental cavities, and it will become pathogenic when there is presence of trauma. So it becomes pathogenic in presence of trauma. Pathogenic in presence of trauma. All right. Now let's talk about the types. Now in types, first of all, the facio-cervical actinomycosis. Okay, then the second type is when it is spreading into the pleura or the thorax and lung. And the third type is when it is in the right iliac fossa. Okay, now first of all we will discuss about the facio-cervical actinomycosis. Now it is the most common variant. So first of all, most common, this is a commonly asked question, which one is more common in MCQs. So it is the most common. Then it occurs in individuals with poor oral hygiene. Now in this, what really happens is there occurs a chronic subacute inflammation. Now this subacute inflammation, what it does is it causes the formation of a lumpy jaw. Okay, now it is seen to affect the jaws, the cheek, and the salivary glands. Okay, then these all undergo suppuration, that is inflammation. Okay, there is extensive induration. Also there is presence of multiple subcutaneous nodules over bluish colored skin of jaw. Now they will rupture and lead to the formation of multiple draining sinuses. All right. Now thorax and lung, it is usually seen in children. Okay, because of the inhalation of the spores. Okay, inhalation of spores. Then what we see is it extends to the pleura, then the chest wall. All right. Then there is also one more thing that you must remember. After the chest wall, it can also spread uh, into the yeah, just this much. Then it will form a discharging sinus. Also, there will be fever because of the empyema. Empyema. Okay, now coming on to the right iliac fossa. This basically occurs when there has been a surgery. After surgery, when there is mucosal injury, when there is mucosal injury, all right, or there is discontinuity, usually after appendicectomy. What happens is they present normally, they slowly migrate to pericecal region. There they invade the soft tissue, the subcutaneous tissue, and then they cause the suppuration. All right. Then they can also affect the portal venous system. A very important thing to remember in all three are there is no involvement of lymph nodes, unlike tuberculosis. Now, in this right ileal fossa, it has differential diagnosis such as Crohn's ileocolitis, also carcinoma calcius, calcius. All right. Then we will discuss about the treatment. In treatment, there is general treatment since it is low grade. So first of all, we have to give the antibiotic prophylaxis, which is our penicillin, that is 10 to 20 lakh units per day for 6 to 12 months. All right. If there is presence of osteomyelitis, if osteomyelitis is occurred, now what is osteomyelitis? It is basically when the osteomyelitis affects the bone, that is the medullary cavity of the bone. Okay, the medullary components of the bone. Then osteomyelitis is said to have occurred. If osteomyelitis has occurred, then it needs to be curated out, and the sinuses, if they have been formed, the discharging sinuses, they need to be excised. All right. So this completes the actinomycosis. I hope you understood. Thanks for watching.